From the high and mighty, the elite and the hoi polloi, the message out of the 9th Stop Cervical Breast and Prostate Cancer in Africa conference in Nairobi was that cancer knows no creed nor class.
In the spring of 1996, I started having problems urinating and sometimes having sharp pains after urinating. I visited my general practitioner and he referred me to an urologist. He took some blood and called me back on the 10th of June, 1996. He informed me at the time that my PSA, prostate-specific antigen, was 31. Cancer is in my family. My two brothers have also been diagnosed with prostate cancer.
And at first I had 6 months of chemotherapy, then surgery, and then radiotherapy. And I'm happy to say that today I have no evidence of disease.
It gets out of my mind. The screening that they use now, a picture which comes on the screen immediately, is what discovered the lump. And the reason I went for a second time is because I felt like I had a lump. So it's very important we check ourselves because it can save your life.
Taking the cue, President Uhuru Kenyatta said the government will not spare any effort in tackling the cancer menace in the country.
More importantly, we should focus on stopping people from dying unnecessarily. The key to this, to saving lives, is prevention and early diagnosis.
With 3,000 new cervical cancer cases being diagnosed in Kenya every year, the disease burden is rising to debilitating levels.
Is documenting success from using simple, effective methods for detection and treatment of cervical cancer. These procedures are of low risk to patients.
The head of state said Kenya will soon open her doors to cancer patients seeking treatment from the region and Africa, noting that already the government is increasing budgetary allocation to cancer research and treatment facilities.
In the spirit of African brotherhood and sisterhood, we shall open up the services of these centers to all our brothers and sisters across the region and the continent.
The conference host, First Lady Margaret Kenyatta, said the cancer pandemic is ravaging the continent.
As chairperson of this forum, I look forward to working with you all. I want to assure you of my commitment and support to fight cervical, breast, and prostate cancer across Africa.
Namibia's First Lady Monica Gengos, in a speech on behalf of African First Ladies, said Africa has reached breaking point as more patients suffer from cancers of all kinds.
Accessibility and mobility of services is key. Affordability is another key issue.
The Namibian First Lady cautioned African governments against spending more funds on recurrent expenditure at the expense of research.
Developing a world-class African treatment facility or funding African solutions through research funding for African scientists and African researchers.
When Africa is home to the 10 nations with the highest incidences of cervical cancer, it cannot be business as usual. This conference must ask, what does the potential portend for our national socio-economic fabric?
Health Cabinet Secretary James Macharia called for sobriety in discussions over the new NHIF rates, noting that beginning this month, cancer patients will be covered under the fund.
To come up with a rate which is now 1,700, that cannot even cover the prescription or the consultancy. So when some people say that the new rates are expensive, and yet you know to treat cancer you require 1 million shillings and above, clearly we need to engage in constructive dialogue.
The 3 days conference themed Investing to Save Lives the role of public-private sector partnerships organized in conjunction with the Princess Nikki Breast Cancer Foundation is aimed at raising awareness and providing advocacy opportunities. Judith Akolo, Channel 1 News.